Hi, Assalamualaikum and good day to all doctors and friends. So we are from Group A and supervised by Prof. Dr. Salina and Dr. Muhammad Fawaz presenting about Vasomotor Rhinitis. So our content includes introduction, sign and symptoms, investigation, management and complication. So what is vasomotor rhinitis? Vasomotor rhinitis is inflammation of nasal tissues that describe a syndrome of chronic symptoms of nasal congestion, sneezing, and rhinorrhea, unrelated to any specific allergen that persists throughout the year. There are some triggers for vasomotor rhinitis includes spicy food, stress, cold or dry air, any drop in temperature, perfume or cologne, cigarette smoke, paint fumes, and also air pollution or smoke.
Moving on to the symptoms for vasomotor rhinitis, the first one will be paroxysmal sneezing. These are bouts of sneezing that start just after getting out of the bed in the morning. Second symptom will be excessive rhinorrhea. This is profuse and watery and may even wet several handkerchiefs. The nose may even drip when leaning forward. Third symptom will be nasal obstruction. It alternates from side to side and is usually more marked at night. The last symptom will be postnasal drip. For the signs, the nasal mucosa over the turbinates is generally congested and hypertrophic. However, in some patients, it may even be normal. To diagnose this patient, a thorough history is taken from the patient, and investigations such as the skin prick test and specific IgE measurements must be negative.
For management, it can be divided into non-pharmacological treatment and pharmacological treatment. For non-pharmacological treatment, first, avoid triggering factors, for example, the perfumes and tobacco smoke. Nasal irrigation also can be done in patients with vasomotor rhinitis. For pharmacological treatment, first is nasal corticosteroids. These medications help to reduce inflammation in the nasal passages and can relieve symptoms such as congestion and postnasal drip. Second is nasal antihistamines. These medications block the effects of histamine, which can help relieve symptoms such as sneezing and itching. Nasal ipratropium. This medication can help reduce nasal discharge and runny nose. Nasal cromolyn. This medication helps to prevent the release of histamine and other inflammatory substances in the nasal passages. Oral medications. In some cases, oral antihistamines or decongestants may be recommended. Immunotherapy. Allergy shots may be helpful if vasomotor rhinitis is triggered by allergies. Surgery is rarely done. Surgery may be recommended in severe cases such as turbinate reduction surgery. It is important to work with a healthcare provider to determine the best treatment plan for you based on the severity and underlying causes of your vasomotor rhinitis. Next, we move to the complications of vasomotor rhinitis. First is obstructive sleep apnea or OSA. Vasomotor rhinitis increases the risk of developing OSA due to increase in airway resistance caused by higher nasal resistance. Second is mouth breathing, which is due to congestion that occurs in the nasal passage. The body notices the lack of airflow, which causes an individual to switch to mouth breathing automatically. Third, recurrent tonsillitis. Fourth, middle ear infections. Fifth, nasal polyps, which is caused by any condition that triggers long-term irritation and swelling or inflammation in your nasal passages or sinuses, such as infections or allergies, which may increase your risk of developing nasal polyps. Next is sinusitis. Bacterial infections or viral infections, as well as allergies, can irritate them, causing them to get blocked and fill with fluid. The other complications of vasomotor rhinitis including difficulty sleeping and tired feeling during the day, difficulty concentrating, and also irritability.
Vasomotor rhinitis is a common condition that can cause significant discomfort, but it is not well understood. Here are some take-home messages for vasomotor rhinitis. First, vasomotor rhinitis is a type of non-allergic rhinitis, which means it is not caused by an allergy. Second, the exact cause of vasomotor rhinitis is unknown, but it is thought to be related to changes in blood flow to the nasal tissues. Third, lifestyle changes such as avoiding triggers like cigarette smoke or strong odors and using a saline nasal rinse may also be helpful. The last one, if symptoms persist despite treatment, it is important to see a healthcare provider to rule out other underlying conditions and discuss alternative treatment options. These are some of the references that we use. That's all from our group. Thank you.